My name's Mia Collett. I'm one of the business managers at Panoramic Associates, and we're joined by Kate Blackburn today as part of our Public Health Spotlight campaign, inspiring the next generation of Directors of Public Health. Kate, if you'd like to start by introducing yourself.
Of course, thank you. So I'm Kate Blackburn. I'm the Director of Public Health for Wiltshire.
Oh, brilliant. And can you provide a quick kind of summary and introduction as to your career and how you got to be a Director of Public Health?
Yeah, of course. I trained as a microbiologist, but soon came to realise, although I did enjoy that very much, I like people too much, and actually being in the lab on your own could sometimes be a bit isolating.
Okay.
So I moved from that into clinical trials, pharmacovigilance, then moved into the NHS, doing some work around finance and performance management. But I always truly knew I wanted to be doing something where I was using good evidence and changing outcomes for people rather than maybe just filling in spreadsheets. So I had the opportunity to go and work for the Regional Director of Public Health at the time that public health was transitioning into local authorities, which I absolutely loved. And from then on in, it was set. I knew public health was going to be the only thing that I wanted to do.
Oh, perfect. Thank you. And can you describe what is a Director of Public Health role, in your opinion?
Wow. Well, it's a privilege.
Yeah.
It's absolutely a privilege.
Oh,
it's an enormous role, but it's such a joy to fulfil. You're the principal advisor on health matters, really, for your local elected members, system partners, any other officers. And I think you are the voice of your community, so you have to know your population. And I quite often liken the role of the DPH almost a bit like a conductor, because you can't ever do this on your own. This is all about your team and the wider team in the system, and really about, I'm not an expert piccolo player, for example, but if somebody in another organisation is, you can really bring them in and learn from them. And that's how together you make changes, I think, for the better.
Oh, perfect. That's a great explanation. Thank you. And what's it like to be a Director of Public Health specifically for Wiltshire Council?
Well, I love it. Which I would say that, but it's true. So Wiltshire Council, we're a really large rural authority. It's a beautiful part of the country.
Yeah, agreed.
I think you've probably seen that today. And we've got a really varied population. So we've got a very large military presence within Wiltshire. We've got a large boater community, and we've got just over 500,000 people that live in Wiltshire, but spread out over a very large geography. And so I think probably one of the main things for us in Wiltshire is always demonstrating that whilst on average our indicators and outcomes for the population look pretty good, actually when you really dig into the data and you look into those smaller pockets across the county, you can see where we very much have inequality, and where we can all do much better together as a system to improve that.
That leads me on to my next question really well, actually. What is unique about the population across Wiltshire that provides kind of both challenges and opportunities for you as Director of Public Health?
Yeah, so I think, our uniqueness is around the difference across the county. So as I say, we've got large military present, both serving and veterans, and that provides us with so many opportunities in terms of working with our military partners, really looking at how we can inspire future generations, aspirations, etc. But we also know that that population can suffer from poorer health outcomes. So really, how do we work in the best way possible to make sure that everybody has the best health outcomes? Our boater population, and this is one that we're really proud to be working alongside. During the pandemic, it really shone a light on how difficult it was for the boating community to access different services. I think that other population groups, it's just more accessible. And so we've spent a lot of time, the team have done some fantastic work actually walking the length of the canal. We've got 63 kilometres of canal in Wiltshire, having conversations, getting to know people. And I think that's the key for me with Wiltshire, is getting to know our community and not just presuming that everybody is the same and needs the same. And then our communities help us so much in terms of their knowledge, their expertise, and how they're already supporting each other in a fantastic way.
Wow, that's a really helpful overview. Thank you for that. And just casting your mind back to your career to date, what would you say is your kind of key, most rewarding experience as a Director of Public Health so far?
Wow. Do you know, that question is so hard. It is so hard, because I think every day there's the potential every day for my socks to be blown off by things that happen. It truly is. I think the reward really for me comes from the team. I think I said earlier, this you can never change population health as one person or even one team. So really investing your time and energy in developing and building your team in terms of their resilience, their knowledge, that's really essential for me. So the reward I have, probably the most rewarding part of my job, is that my team are committed to finding the joy in each day and finding the joy that helps the population. And we have a big Teams channel all together where we share each day how we have fulfilled our purpose as a public health team, and including how we've done that with joy.
Okay.
And I think having a team that is always motivated, always willing to go the extra mile, determined to change outcomes for the better, you can't have a bigger reward than that.
Yeah, that's lovely. I'm sure the listeners will take a lot away from what you've just mentioned. So thank you for that. And then on the flip side, kind of cashing my back to the most challenging experience and more importantly, what you've learned from that challenging experience.
Yeah. So I think that's probably more of a personal one, if I'm honest, and is from the pandemic. And whilst the work was challenging, it had to be done, and we were all in the same boat, and we could see that we were making a real difference in protecting people's health. I think the challenge for myself as a director of public health, as I'm sure lots of other people found, was actually being able to effectively balance the work-life balance at that point. And my children were both in their late teens, and I know I wasn't able to give the attention that I would have wanted to them at that point in time.
Of course.
And I think that was inevitable because that was an unprecedented time. And so anybody trying to have a work-life balance then was really hard. But that for me has been the most challenging thing, looking back and regretting what I could have done, but definitely learning from that. And so I have very strict rules for myself and for my team, which is, outside of emergencies, I don't expect you to be working in the evenings or overnight. Everyone in my team has to go out at lunchtime into the outside world. You have to look after yourself, otherwise you can't look after other people. Yeah,
that's a really good piece of advice, and kind of championing public health as the heart of what kind of you do, front and central. Are there any other points in regards to maintaining a work-life balance that you particularly live or breathe by, or you would share with the listeners in regards to being a director of public health but also managing that work-life balance?
Yeah, of course. I mean, there will always be exceptions. So there will always be things that happen that we can't predict. And of course, at that point, it's all hands to the deck. You don't work in public health unless you are truly committed and have a passion for improving population health, and that doesn't generally just happen Monday to Friday 9 till 5. But outside of those exceptional times, I think it's really important to understand your own rhythm. And by that I mean, I know first thing in the morning, that's when I'm good. That's when I can plough through lots of work. My brain's really working well for me. By the time it gets to later on in the afternoon, probably not so much. It's going to take me a couple of hours to do something at that point that may only take me half an hour in the morning. But that's different for everyone. So I think, you've got to find your rhythm, and then you can plan your day. That means you end it still feeling energised and not feeling really, really, really drained. And I think the other thing I would say, and I say it to my team every day, is you have to find your joy. Now, for some people, joy comes in the form of a spreadsheet and data and numbers, and that really motivates and energizes. For others, it's teaching and presenting and talking to community members. And I think if you can identify what brings you most joy and energy, you can then adapt your working style to make sure you've got at least one joyful moment each day. And after that, you're laughing because then work becomes a joy.
God, that's some really great advice. I'll personally take some of that away myself. Thank you very much. And then what's one thing you wish you would have known before becoming a director of public health, kind of thinking back, that you'd like to share with the listeners?
Well, I think, so I became a director of public health right at the very beginning of the pandemic. And so I think it was probably quite unique in the fact that we were all learning together at that point. I wish I'd known that it was okay to not know.
Okay.
Because as I said at the beginning, you are the principal advisor on all matters relating to health. And that's a big responsibility, but which no one individual can possibly be on top of all of the time. And that always then comes back to your team. You have a team of experts that work with you, and a very brilliant lady from the United States actually gave a talk that I went to once, and she talked about, being confident enough to show your underbelly and to ask for help and support when you needed to. And I think that would be my advice to anybody in any position. It's fine to ask for help and support.
Okay, brilliant. Thank you. And then have you got any comments in regards to what do you think the kind of biggest future priorities will be within public health, whether that's kind of Wiltshire Council led or kind of across the country?
Yeah, so I think on a locality basis, there are things that we're already working on that we can see are having a real impact on our population. And that would very much include things like children and young people's mental health, well-being and resilience, cost of living and food poverty are really quite important in counties like Wiltshire, where, as I say, you've got big geographies, quite often got large areas with no low-cost, good quality food in place. So there's lots of things we work on currently, but I think looking towards the future, you always have to keep an open mind, because I don't think any of us ever know what's coming around the corner. So just making sure that the technical expertise is in place within teams, and also your relationships across the system is so fundamental, having good relationships. But I think for me, as with many other directors of public health, it's going to be the impacts of climate change on health that I think that we really, really need to be getting to grips with now, to make sure we can mitigate as much as possible.
Thank you. Yeah, that's really interesting and helpful. And the next interviews, what tips do you have for aspiring directors of public health on how to prepare for their interview and the interview format itself?
Yeah. So preparing for interview, I think it goes back to the fact that you are the voice of that community. So wherever you're applying to be a director of public health, know your community. So I think everybody would know that you prepare and you look at the Joint Strategic Needs Assessment, you look at the Council's forward plan, you look at the ICB 5-year strategy. You know, there's lots of things on paper that you can look at so that you've got the facts and the figures and the data. But go and talk to the community. You know, really get a feel for what it's like. We have what we call our local area boards. We have 18 local area boards in Wiltshire. Every single one of those represents a different part of the county, and every single one of those is different, and they have different health outcomes, and they have different priorities in terms of wider determinants of health. It's really important to know and understand all of those things. So if you're applying for a role, really get down on the ground and get to know what it feels like to be in that space. I think you can't underestimate that knowledge.
Yeah, that's really helpful advice. And then the last question is, what's one final piece of advice that you have for an aspiring director of public health?
Go for it. Go for it. I always said I never wanted to be a director of public health because I had an image in my head of what that was. Probably because I'd read, you know, on different websites, what is the role of the director of public health. And it's quite daunting when you read it, but actually it's the best job in the world, and it's the best job I have ever had and probably will ever have. And you can make it your own, and you can make it fit your personality and your style and how you find your joy, because you work with the people that live here to do that together. So just go for it. You will never regret it.
It must be so rewarding.
It is.
And I've learned a lot. I know the listeners absolutely will have learned so much. So thank you again, Kate Blackburn.
You're very welcome.
Thank you, everyone.